Hello. I am glad you are here. Happy to see you in here today and Type 1 and Midlife and Beyond podcast. And I'm going to chit chat today, share some information. And the topic today came from a listener here. She reached out and she shared this is a quote from her. I've always heard that taking hormones is dangerous, causes cancer. I'm confused. I have girlfriends who are on HRT, which is hormone replacement therapy, and love it. So, how do I know if HRT is right for me? This is a great question and very much heard in the community. And what I'm going to do today is talk about the common myths that have got us all confused. Myself included, discluded, because I used to be confused too. And I'm happy to say that I have tuned in and synced up with some amazing doctors, functional medicine doctors, and research and science that proves that bioidentical, which are like the body's natural hormones, are very beneficial to our health, especially when we're living with diabetes. And one of the things, this is my passion because I live with type 1, just like many of you. And I'll tell you what, when all these changes started to happen with hormones dropping, my blood sugar was a hot mess. And menopause, and as we're going to back up and say perimenopause, because that's that period of time where all the adjustments are happening, it can really wreak havoc. And it's obviously much more dramatic when we are also managing diabetes, blood sugar, and all those things, right? So it is so imperative that no matter what your decision is around hormone replacement, whether it's you're on the fence right now and you're not quite sure if this is a path that you want to go on, or if you're very curious and what you learned today may or may not change your mind. This is not judgment. This is not trying to convince you to do one or the other. I am here to present my story, present the facts, and then you can take that. And I hope that you can make an informed decision based on what you need and what you feel comfortable with. So that's my goal here. And my own personal story, and I've shared it here on the show, but I had those same sort of beliefs, misinformation, lack of education, that hormones was, something I didn't need, that I would be just fine without it. I would just coast along, keep on doing what I was always doing to keep my blood sugar, my weight, and my mood and my sleep on target. And it worked for a little while until it didn't. Until I really understood the changes that were happening. And that's when I had to open my own eyes to really the truths and really the overall benefits that hormones do give all women, especially those of us living with diabetes and managing that. And I want to start off with, we're going to debunk the myths around HRT. And in 2002, this was a landmark study that challenged the belief that hormone replacement therapy, HRT, protected women from heart disease and other chronic illnesses. The Women's Health Initiative study, we are hearing a lot more about this from experts and doctors in the space that are trying to inform us of what was then created a lot of fear and avoidance on either getting on HRT or hormone therapy, or the fact that there were so many women that were on it that were quickly taken off just based on these studies that were very inaccurate and didn't really give a conclusion as to really what any sort of detrimental effects that HRT could have on a woman's health. So I was listening to Dr. Felice Gersh, and she argues. So this is something that she has written books on and articles. You can find her online and research her further. But she argues that HRT is vital for all women, highlighting the bioidentical forms. So that is like I was saying, similar and like our own body. Bioidentical forms of estrogen is anti-inflammatory, protects the heart and brain, and is essential for the immune system, bone density, and gut health. And that's just the tip of it. I mean, there are so many benefits. It just goes to show you that our hormones are something that our body is used to having, functioning with, thriving with. And when that is depleted, which is what happens naturally, our body and our function, our everyday ability to do what we've always done, thought, felt, blood sugar, don't forget the blood sugar, just goes downhill. It just does. And again, it's different for everyone. Not everybody has the same response. But biologically, we are all created the same. So whether you are experiencing symptoms, you have asymptomatic menopause. I hear this a lot from women that I'm working with, where they're like, well, I don't really have the hot flashes anymore. My weight's not out of control. Then the blood sugar topic gets kind of brought into that. And that's when things change. And then they realize, yeah, it has been a little harder to manage blood sugar. I am needing more insulin. I am on a roller coaster. And just to continue what Felice Gersh shared in this study, or her analysis of this Women's Health Initiative study, it virtually, the way she concluded this, which to me means everything, is virtually every cell in a woman's body has estrogen receptors. It has estrogen receptors. The entire body suffers when estrogen levels drop during menopause. So this is a way that we can mitigate that. And again, find ways to supplement, or what I like to call replenish, because it's really bringing in what has been depleted. I like to use an analogy too. We think of different sort of disease. Obviously, diabetes is one, because we need the hormone insulin. People with Hashimoto's, thyroid disorders, they need thyroxine, and those hormones to keep that hormone going and working and functioning. The same thing goes for, oh gosh, what's the other thing I was just thinking about? What's the other hormone? Oh, vitamin D. Vitamin D is a hormone. Do you know what happens when we are low on this hormone? Again, why would we not supplement? Obviously insulin, because we need that to survive. Why would we not supplement thyroid hormone? Why would we not supplement vitamin D? These are all essential, just like estrogen, progesterone, and testosterone. They are essential too, and we need these to feel our best. I want to share a story too. We were at a high school reunion. My husband, 40th anniversary. My husband's type 1 as well. If you didn't know that, just a little reminder. But we were at a high school reunion just a few months ago, and on 4 different occasions. So this was a couple hours talking to different women, my age, late 50s, and the topic of health, hormones, sleeplessness, all these things just kind of came up through the conversation. And it is amazing. And I just took time to listen and to see where they are. And all 4 of these separate conversations, separate women, none of them were currently on hormone replacement. And I was just kind of get their feelings around it. And bottom line is, their doctors have never suggested it. They just felt they had to just kind of keep going as they were. They had just had to kind of suffer through the symptoms that they were feeling. And then one of the things that really struck me is that, and this is kind of points to the topic or the little side note that I just made, is that they felt that it was having to get on a drug. and they didn't want to have to put drugs into their system or rely on medicine in order to function, to feel their best. And it was really interesting. And I didn't really realize how much kind of stigma there is around that mindset. So it gave me an opportunity to say the same thing I just shared here. It's a hormone. This is not a drug. This is something your body needs. There are drugs, obviously, that we take to treat symptoms, whereas hormones are something that are really to prevent symptoms. It's not necessarily to to fix symptoms. It's really just kind of it's a preventative approach, right? So I'm going to give you some benefits of bioidentical hormones. So like I was just saying, they're anti-inflammatory. And this really goes into blood sugar, doesn't it? So typically women that over the age of 40, the diagnosis of prediabetes type 2, those statistics and those studies are showing that those diagnoses are going up. And little do we know that doctors are not necessarily tying that into the insulin resistance piece of aging with this, obviously, what's going on with our lower hormones. Well, guess what? With us with diabetes, measuring it, seeing it on our CGM, the roller coaster, the ups and downs, the need of more insulin, we can pretty much view that as long as we've got access to good devices, like many of us are very thankful to have. The average woman doesn't have that. She just sees herself with a scare from the doctor saying that you are becoming pre-diabetic. You have a possibility of type 2. Again, that could lead to medication, to treat that insulin resistance. So that is a really key point, is the anti-inflammatory properties of bioidenticals and what it really does to serve all areas of our body, especially those of us with blood sugar management. It also protects the heart, the brain, the immune system. Again, it's another hormone. Hormones do protect our immune system. The role in maintaining insulin sensitivity, like I was saying, bone density. This is a huge one. The combination of these hormones, along with that other hormone I mentioned, vitamin D, along with K2, which is an important mineral that gets kind of tied into keeping our bones strong and healthy. And not to mention gut health. And I am going to be talking more about gut health in here soon. So stay tuned for some episodes. I'm going to be joined by Kelly Schmidt. She is a type 1 herself, registered dietitian, and she is an expert in just the gut microbiome. And I'm going to be sharing some things that have happened to me recently this past year with my gut microbiome and the process of healing that it took me, and how menopause was definitely part of this equation. So the negatives. So this is what happens when, and these are the symptoms. These are the ones that we tend to hear about. Us girls get together and we talk about these things. But joint pain. These are common side effects when our hormones are not in their optimal ranges. Low libido, frequent UTIs, so that's urinary tract infections, dry skin, depression, again, low hormones, that's suppression of the serotonin, all those things. Not to mention when we're feeling bad, when we're not feeling vital, it can obviously lead us to a depressive state, right? And it increases our cravings. Again, when our blood sugar is a little out of balance, harder to manage. When our blood sugar's high, how we're reaching for more sugar. It's that vicious cycle, right? And things like weak pelvic muscles. And this leads to incontinence. And this is something that is seen for many of our moms, our grandmothers. I wished I had known what I know now sooner, to help my mother at an earlier time, just so that she wouldn't be suffering with these type of symptoms and side effects. Incontinence is very much seen in nursing homes and palliative care, and all this could and still can be prevented if women decide to take this step. And basically, we can kind of shrivel up when our hormones are depleted. And those are some definite things to consider. So how do we navigate the decisions around HRT hormones? And these are some steps to consider. And this is what I want you to walk away with today. Um, Hormone testing. Again, I think just to begin with, you need to find a practitioner that, a medical guidance that understands the importance of getting your hormones tested, no matter your age. Even if you're post-menopause, you've got to have a starting point. You've got to have a starting point. You got to have that number. You got to know where you are in order to know what sort of replenishment, in this case, HRT, can be prescribed so that you can monitor those levels and find out where your happy place is. Again, for the whole body to function its best. And, one of the things that I noticed, especially, this was the biggest change for me once I got my levels. I went on hormone replacement about 4 years ago. But one of the most immediate things was my insulin sensitivity. I'll tell you, because my insulin needs really went up before I'd started on HRT. So to me, that was very evident, very obvious that they were helping. Not to mention, I was sleeping better. The hot flashes went away, more focused, more energy. My weight settled it back into where it was. So yeah, it's real important to get with a practitioner. That would be my number one suggestion, is to find somebody that understands the importance, respects your time and your questions and your needs around this topic, especially a practitioner that also understands diabetes. So there's a lot of points to this, I understand, but and know that you can always reach out to me. I am here. You can reach out to me. Again, my website is abundanthealthwithmelissa.com. Shoot me a message. And if you're not on my email list right now, there are some free guides here in the show notes that you can grab, and you can always stay in touch with me. That's an easy way to get a weekly newsletter email from me with just ongoing support and resources, and a way to obviously reach out anytime with questions. And yeah, like I was saying, get the doctor that's going to understand the importance, know how to test your hormones, and how to interpret the results. So who knows what optimal is, and what is optimal for you based on all the things that you need living with diabetes as well. And usually what happens is you'll meet, you'll have the discussion, they will order lab tests. Again, if you have any questions about what sort of lab tests that you should be requesting and you need some support on that, reach out. I'd be happy to help you with that. And to test, then they're going to sit down and they're going to look at your results, and they're going to suggest which types, and it should be all the hormones, because again, they work in conjunction with one another. For instance, you're not going to take estradiol alone. Progesterone and estradiol have to be in balance. Otherwise, you can get estrogen dominant, which is a term we definitely hear a lot about. So it is about getting kind of titrated, finding out what those levels are. And there's so many different ways to apply the hormones. They can be creams, they can be vaginal creams, they can be hold on just a minute to let me look at my notes. They can be oral. That's generally just progesterone. It is recommended that estrogen is delivered topically or through the skin or through patches. That's another way. So again, creams, patches, pills, gels, troches, or pellets. And definitely do your research on pellets. I have my own opinion about pellets. And I know a lot of trusted experts are not in favor of pellets, but definitely do your research and ask questions. And what they will do once you decide on the type of formula and the strength of formula and how often you'll administer, the cream or the pill or the put the patch on, all those things, then they should be retesting you within 3 months, just to look and see what your levels are at now after 3 months of being on the HRT. And this is the only way to really do this in a very a very proactive way, for them to just say, okay, this is what you're going to get. Here's your dose. I'll see you in a year. That's not good. That's not good care. That's not monitoring your needs. And really, it's not specifically looking at your unique needs, dosing, the ability of your body to absorb it, all those things, not to mention to metabolize it and for it to be metabolically healthy. So there's a lot of different pieces to the puzzle. But again, find a practitioner who understands this and stay informed, educate yourself, stay in touch with me. The long-term benefits and the better management of blood sugar is going to be your biggest benefit and overall aha when it comes to HRT, because it will make a difference. I promise you that. Okay, just a recap. So I came in here and I talked about the common myths, and they are common, the myths that hormones are harmful, but it is important to know really how they benefit us, and to have that conversation with a trusted practitioner that can give you unique direct advice to you as a woman and your stage of life and what you need specifically. It's so important. And I have a few other things here in the show notes, just some resources that you can look at. You can visit the North American Menopause Society. Again, I'll link that right here. That's a great place to go for more information and a way to find a doctor near you. And again, a lot of doctors do this telemed. A question I get asked a lot is whether or not you need to see a doctor in person to be prescribed HRT. And in theory, not really. It's not generally a physical exam. They're going to talk with you. I do recommend video, so you get to kind of know them as a person across the video screen, kind of how I'm talking to you today. But running the labs, reading the labs, go over in the labs, and then having that conversation can definitely be done in a telemed type of relationship with a doctor or doctor visits. And just as a reminder, to download, I have some free guides right here in the show notes to stay connected with me. I have one right now that is called 3 Reasons That You Are Frustrated. Maybe weight loss is something that has you stuck right now as you are transitioning into menopause, and it's very much understood. So I share 3 reasons that you may be surprised at that could immediately start to help you, not to mention HRT. HRT is definitely part of that equation, but I'm a big believer in strengthening that foundation, getting those daily habits, as we call it, I put it in air quotes, the sleep, the hydration, the movement, good quality food, reducing stress. Stress is, I think, and I've done so many talks and presentations about stress, about how that is the number one impactor on all areas of our life, but really how our adrenals are starting to get affected too when we're older, past the age of 40. Everything happens over 40, right? But just to be in tune with that. And like I was mentioning with, the gut microbiome, again, there's lots of different areas that we all have to be aware of that could be impacting us as we're aging. And that is something I do as a coach. So it's my favorite thing to sit down, learn about you, and just to discuss what could be kind of filled in, added in, not deprived, just complemented, and to do a little bit better. And generally speaking, most of us knows what those things are. And as a coach, that's what I get to do. I get to together we come up with these things that you're going to work on, and I'm there to support and offer accountability as we work together. So anyway, I hope this has been an insightful conversation for you today, and this topic really did serve you. It's a wide open question. It's an important question, but it's definitely something to consider. And I think it's important that we advocate for it and not to be afraid to ask questions, to seek a medical practice, a medical doctor, a hormone specialist that is going to listen, understand, and to do the best for you in this time of life. So enjoy talking with you today. And please share this show with other women who need this too. And don't be afraid to reach out if you have any questions. You can drop me a line on Instagram. I'm at Blood Sugar Boss. Send me a note off my website. Again, I'm sorry, abundanthealthwithmelissa.com/contact, or you can just go to the podcast page and there's a space in there where you can send me a note with your questions. I'd love hearing from you. And if you have any other questions, something specific, or maybe it's not so specific, just something you're curious about, drop me a note, and I will share and feature that question right here, because chances are other women want to know it too. So let me know what you need support with. And thanks again for being here and taking time to better understand hormone replacement therapy, living with diabetes. And I'll be back in here same time next week. Bye for now.